Bismillah ar-Rahman ar-Rahim. The identity of a doctor: professionalism, responsibility, and trust. Welcome to the new episode of Introduction to Clinical Medicine. Dear students, in the previous lecture, we talked about the shift from books to bedside, about how medicine changes once patients become your teachers. Today, we will talk about something even more important: who you are becoming as a doctor. Clinical medicine is not only about learning signs, symptoms, and diagnosis. It is about developing an identity that patients will trust with their lives. This lecture is about professionalism, responsibility, and trust. Three pillars without which clinical knowledge becomes dangerous. Part 1. When does someone become a doctor? Many students believe, I will become a doctor after final year. And maybe you are also believing like this, or after house job. Let me correct that misunderstanding gently. The moment a patient listens to you, the moment they answer your questions, the moment they allow you to examine them, you have already been given a doctor's responsibility. You may not have a degree yet, but in the eyes of the patient, you represent medicine. This is why your words, tone, body language, and attitude matter from day one. Now the second part. Professionalism is not about the white coat. Many students think professionalism means wearing a white coat, speaking in English, carrying a stethoscope. These are symbols, not professionalism. True True professionalism is about honesty, punctuality, respect, accountability. A professional student does not lie about findings, does not examine without permission, does not gossip about patients, does not disappear when work becomes uncomfortable. Professionalism is what you do when no one is watching. Third part, responsibility begins before authority. As students, you have limited authority, but you already have real responsibility. You may not prescribe medicines, but your words influence patients. You may not make decisions, but your behavior shapes trust. Never forget, a careless student can harm more than a careless doctor, because patients assume innocence where there is ignorance. Your responsibility includes knowing your limits, asking seniors when unsure, never pretending knowledge you don't have, saying, "I will confirm this with my senior," is not weakness. It is professionalism. Part 4. Trust, the currency of clinical medicine. Patients do not give you their trust because of your degree. They give trust because you listen, you respect, you behave safely. Trust is fragile. It is built by explaining before examining, maintaining confidentiality, speaking gently, acknowledging fear. And it is broken by arrogance, jokes at the patient's expense, careless comments, casual disclosure of information. Once trust is broken, even correct treatment may fail. Part 5. Ethics is not a separate subject. Many students think ethics is a topic for later years. In reality, ethics begins the moment you enter the ward. Ethical behavior includes taking consent, respecting privacy, examining only what is necessary, covering the patient properly, stopping when the patient is uncomfortable. Remember, just because you are allowed to examine does not mean the patient is obliged to tolerate discomfort. A good clinician always chooses dignity over demonstration. Part 6. Common unprofessional behaviors to avoid. Let me highlight a few behaviors that damage your identity early. First, laughing or smiling at serious patient complaints. Second, using mobile phones during patient interaction. Third, discussing patients loudly in corridors. Fourth, exaggerating findings to impress seniors. Fifth, making patients feel ignorant or inferior. None of these make you confident. They make you unsafe. Part 7. Balancing confidence and humility. Patients need confidence, but medicine demands humility. Confidence says, I will take care of you. Humility says, I will ask for help when needed. Part 8. A message from a teacher. I want to leave you with this thought. Every patient you meet is silently asking, can I trust you? They are not judging your knowledge. They are judging your intent. If your intent is sincere, your learning will accelerate naturally. Clinical medicine rewards sincerity over show, patience over pride, responsibility over brilliance. So I'll close. Today, you may feel like a student, but from today onwards, start behaving like the doctor you want to become. Because habits formed in third year become character in final year. In the next lecture, we will discuss 3 pillars of being a doctor: knowledge, skills, and attitude. Until then, remember, knowledge impresses, but character protects patients. Thank you.